Hello, my name is Sharon and I'm a post-operative liaison nurse here in the sports surgery clinic. My role is to support and advise you following your knee replacement after you are discharged from SSC. The aims of these short videos are to provide you with information that might help you with your recovery initially in the first 6 weeks post-discharge from SSC. Please also refer to the information leaflets that you're given on discharge from the nursing staff on the ward. It is very common to experience pain, discomfort and stiffness in the knee in the first initial 6 weeks. You will have been provided with a prescription of painkillers by the nursing staff when you are discharged from the sports surgery clinic. Please take this prescription to your local pharmacy where they will dispense these painkillers. Take these painkillers regularly during the day in the initial first 2 weeks rather than just taking them when you have the pain. Taking these painkillers will also help you with your rehabilitation exercises. Applying ice to the affected knee will also help with any pain, discomfort and stiffness and also any swelling. It's very common to have a disturbed sleep pattern due to pain and discomfort initially as the weeks progress. This will settle over time and you may find it more comfortable to sleep on your side with pillows in between your legs. It is common to experience swelling to the knee, which may extend up into the thigh and down to the ankle. You may experience this a few days after you leave SSC, and this is nothing to be concerned about. We encourage you to elevate the leg on a chair or on the bed when you are resting, and the swelling will settle over time. Bruising is very common after a knee replacement and can occur a few days after you've gone home. It can occur around the knee, around the thigh, around the calf and down into the ankle. It can take a few weeks, 4 to 6 weeks to settle. Icing the knee regularly will help with the bruising and the swelling. Your wound has been covered with a waterproof dressing. A nurse will discuss the care of your wound on discharge. You may take a shower with this dressing on. In the initial recovery, you may find you get a small ooze on the dressing. This is perfectly normal. Only remove the dressing if it becomes extremely soiled or the dressing becomes loose. Wash your hands before and after changing the dressing. If you're concerned about your wound at any stage, please contact the SSC and we will advise you on what to do. You will be discharged home wearing white elasticated stockings called TEDs. These are to prevent blood clots. You need to wear these stockings for 6 weeks in total, day and night. We encourage you to remove the stockings daily for a maximum of 30 minutes to an hour to check the skin integrity and any redness to your legs. Moisturize your legs daily as the skin can get extremely dry after 6 weeks. These stockings are meant to be tight. Avoid letting them wrinkle. You will have also been given a medicine during your hospital stay to prevent blood clots. A medicine will have also been prescribed for you on discharge. It is important that you complete the full course of this medicine. If you have been on a medicine of this type before admission, the nursing staff will discuss this with you at discharge. You will have been provided with a rehabilitation program booklet from the inpatient physio team. It is important that you carry out these exercises to get the full benefit of your knee replacement. Perform these exercises 3 times a day, ideally in the morning, afternoon and the evening, allowing periods of rest in between. You may find some of these exercises hard, particularly the leg raise and the knee bend in the initial first period. Continue to do these exercises as they will help with the flexibility of the knee. As you progress, you will find these exercises easier and you will find they will strengthen your knee. You may also find that you might get discomfort during this period. This will settle and the exercises are in the long run helping with your pain management. Be reassured that your knee has been securely sutured and won't open when you're doing your bending exercises. You should aim to walk 3 times a day, starting at 5 minutes at a time, and then increasing this by a minute each day, aiming to get to 10 minutes 3 times a day. Walking will also help with any discomfort or stiffness you may have. You will need to continue walking with crutches for 4 to 6 weeks, and your physio and consultant will advise you when you can stop using your crutches. You should also aim to see a physiotherapist 10 to 14 days after discharge from SSC or as advised by your consultant. Following discharge, you may have periods of tiredness, and there is no harm to take rest during the day, as this will help your recovery. Eating and drinking well will also help your recovery. No 2 days are the same after you go home. You may find some days that you feel fine, and then the following day you have increased pain and swelling. This is all perfectly normal. Family and friends are really important to help you with your recovery following a knee replacement. They may help you with doing the weekly shop or taking you to appointments. After you go home, the novelty of being home can wear off and you can begin to get anxious and worry. Having family and friends around to support you during this period will help with your overall recovery. Although you have been discharged from SSC, we are still here to support you during your recovery. If you have any concerns regarding your knee, please do not hesitate to contact us.